I'd like to now talk about the SHARE model introduced by the Centers for Disease Control and Prevention. It's a really good adult vaccine resource for helping you maybe modify your practice and how you recommend vaccines for adults. So SHARE is an acronym, and the S for share is share the tailored reasons why the vaccine is right for that patient, given maybe their age, their health status, their lifestyle, occupation, what it may be, but what risk factors they may have that indicate the need for this vaccine. The H part of share then is to highlight the positive experiences with vaccines that you've had personally or you've had in your practice and reinforce the benefits and strengthen the confidence in influenza vaccine, for instance, or pneumococcal vaccine in this case. I know I do this all the time. I've been in practice a long time, so I have lots of great stories to share with my patients who might be a little hesitant to get a vaccine, but it might be about my personal family members or my experience with a vaccine because I've received plenty of vaccines in my lifetime. I'm also going to have Sarah go through the ARE part of SHARE.
The A stands for address patient questions. It's normal for folks to have questions about this. They want to know about the side effects, the safety, how efficacious is this vaccine, and they want to be able to hear it in a language that they understand, and that's very important too. And so sometimes I use my personal experience with side effects too, because you can if you can throw a little bit of humor in there. My second COVID vaccine, wow, was that terrible, and things like that. And so talking to them about what to expect is very important. The R stands for remind. You want to remind them why they're taking this vaccine. You want to remind them that it protects them and their loved ones. Do they have a new baby, grandbaby in the house? It's going to protect themselves from serious injury or illness. And most people think pneumonia, well, okay, it's a few days of feeling really terrible. I might be in the hospital. But I think what people forget is for an older person or really anyone to be in a hospital setting for a prolonged period of time, you start to suffer from memory problems. You have issues with dementia and other things that are kind of highlighted, and you don't rest in the hospital because everything beeps all through the night. And so these are important things to have conversations about. And the E is for explain the potential costs. And so again, you have medications. You're going to miss work. You're going to miss family functions, and the financial cost associated with pneumonia and being in the hospital, and then any kind of long-term consequences that you may have. And so just having those logistical conversations listen, this one shot may prevent you from missing out on financial, emotional, and social events that are important to you.